Hi, everybody. Welcome. Thank you for joining us for our Zoom on overcoming loneliness. This Zoom is brought to you by New York Presbyterian Hospital. It's also brought to you by NORC, the City of Yonkers Office for the Aging, the Yonkers Public Library, and we are very happy today to have with us Dr. Holland, who is going to introduce our guest speaker. So Dr. Holland, would you like to say a few words?
So thank you very much, Z, and thank you to the Yonkers Library System and to the Yonkers NORC for inviting us to be a part of this series. First of all, I want to say I am not a medical doctor, but I appreciate you giving me that title today. I was going to start with a bit of an overview, but we're going to really go right into Dr. Marino's presentation. Essentially, though, I want to make sure everyone is aware that our hospital is open, it's safe. We have lots of protocols and new procedures in place in light of the COVID-19 pandemic. We know that a lot of people did delay healthcare, and we want to remind everyone that delaying healthcare can be harmful. And so it's really critical that you make appointments to see your doctors, get your annual screenings and examinations in. Additionally, as just a reminder, New York Presbyterian Lawrence Hospital has a significant commitment to community service. We do a lot of presentations like these, not only to the Yonkers NORC, but also to other community groups around the county. We're available if you would like to request a presentation such as this, we can do that for you. And hopefully we'll provide some contact information at the conclusion of today's presentation. So our keynote speaker is quite impressive, and I want to tell you a little bit about her before you hear from Dr. Marino. Dr. Patricia Marino is an associate professor of psychology in the Department of Psychiatry at Weill Cornell Medical College and is a trained geriatric psychologist. Her areas of interest include the role of social support and physical health on late life mood disorders. Currently, Dr. Marino is a member of the research team at Weill Cornell Institute of Geriatric Psychiatry and serves as a therapist on a late life depression psychotherapy study. She also coordinates several research studies in the area of late life mood disorders. Dr. Marino also has a private practice in White Plains and in New York City. Dr. Marino earned her undergraduate degree from Binghamton University, a master's degree in psychological measurement and evaluation from NYU, and she completed the doctoral program in clinical psychology with a health emphasis at Yeshiva University's Graduate School of Psychology. She received further training in the Department of Psychiatry at Long Island Jewish Medical Center and postdoctoral training in the Department of Geriatric Psychiatry at Weill Cornell Medical College. So without further ado, let's hear from Dr. Patricia Marino, and who will be talking about overcoming loneliness during the COVID-19 pandemic. Dr. Marino.
Thank you. Thank you for the introduction. So welcome everyone. I'm happy to take questions if people are comfortable in the chat or letting us know as we go along. So today we wanted to talk about overcoming loneliness and some transitions in life that occur even outside of COVID, but I think more pressing for people during this period of time. So today I want to, number one, talk about the change in demographic in our community, as well as understanding the impact of changes in roles, loneliness, and social isolation. So the one thing I want to emphasize is the number of older adults globally is rapidly growing, and the demographics of older adults are also changing here in the United States. And currently 13% of the US population is over the age of 65, which is a significant number. And I showed this graphic because I think it's an important representation of how the numbers of individuals over 65 and also over 85 has grown tremendously over the past century, and really projected to continue to grow up until 2050. So as you can see, the number of 65 and older, very big, sharp increase, and we're also seeing the increase in 85 and older. Actually, even more interesting is the demographic, racial and ethnic diversity of aging population is also changing over time. As you can see here, the red bar is 2004 and the yellowish bar is a projected number. We see that the number of individuals who identify as Black is growing, Asian as well, rapidly growing, and Hispanic Americans is also growing. And I think this is really important when we think about the needs of different communities to not only identify the needs as people age, but also how different cultural backgrounds play a role in not only social needs, but also mental health needs. So why are changing roles important as people age? We know that as people age, there is a huge life transition. The most specific is a transition between two relatively stable periods of time. And you go from one life phase to the other. So individuals really are transitioning in many ways during the aging process. And again, really going into a different phase, both from a social standpoint, sometimes financial standpoint, and role transitions. And we know that as people age, a number of things happen that are significant stressors, the loss of friends and or a partner, maybe one injury or illness, retirement, which is a very significant role transition. Many people relocate. I think this is even more pressing during this period of time. I know a lot of people have been transitioning even in where they live, and caregiver responsibilities, which again may also be something during this period of time that's more dominant. Okay, and we know that there are different, again, situations that lead to transition, health and developmental patterns. And we also know in the literature, we talk about healthy transitions as well as unhealthy transitions. And really one of the key factors that we'll be talking about today is one of the things that's really important for a healthy transition is that individuals really learn how to restructure their routine, maintain continuity when you can, really being flexible in your thinking and modifying expectations. Where we see more of an unhealthy outcome is when there's resistance to those changes. Okay, so healthy transitions really allows, works the best when people learn new skills, develop new relationships and new strategies. So I always kind of say to as individuals as they age and I work with them is that things that might have worked for you in the past just may not be working right now. So we have to kind of develop new ways of approaching a situation and also really evaluating and work in developing the ones that have worked in the past. So healthy aging is a really kind of hot term that you might see and really, you know, something we'd like to use instead of looking at it in the other perspective. Is really a lifelong process. And it really is the opportunity to optimize places where we can improve both well-being, socialization, health, both physical and emotional health, and really enhance people's quality of life. And how do we transition? As I said before, we want to restructure your life routine, maintain continuity, create new choices, and find opportunities. And I think this doesn't only apply to aging, but really is something in the past 5 months or so, individuals of all ages have been really trying to develop. So it's a health perspective for everyone, regardless of age. I think, you know, COVID has really given us all the opportunity to work on restructuring our life routines, trying to maintain continuity and connection as best as we can, look at new choices, kind of creating new ways of doing things and finding opportunity. So I think this is not only an aging, but I think also very timely and during COVID. So we know that a lot of opportunities we encourage everyone to participate in is exercise, stress reduction, mental stimulation, and finding new meaning and new roles. I even though I am not a medical doctor, I'm a psychologist, I can't overemphasize the importance of exercise, both for physical and emotional well-being. I think that people have really been very creative finding new ways to exercise. If their places that they typically engage in exercise have been closed, I think people have really thought outside the box of how to reduce stress during this time. And really, we want individuals to remain mentally stimulating as best as they can. Unhealthy transitions, on the other hand, often happen when people feel alienated or have a sense of loss of what is familiar and valued. And again, I think this is also very timely in COVID because people have really had a sense of loss at multiple levels, either loss of someone you care for, loss of potentially a job, loss of just their roles or their routine, and also feeling more alienated and away from other people. So major life changes, role transitions are stressors, and I think most people can agree with that. And we really have to figure out how to help people adjust during those major changes. And for many people, there's a wide range of how it affects them in their mental health. So again, the literature really shows this relationship, I had mentioned this before, of what are events that really can cause unhealthy transitions. Again, retirement, illness, disability, the loss, and you can see loss here is in 3 categories: loved ones, independence, and social roles, as well as financial difficulties, which I think when I originally had developed this talk, it was in reference to aging and retirement and how financial difficulties can be very pressing for a lot of people. But I think, in the context of COVID, many people have had more financial stressors due to loss of employment that has been unexpected for many. Life events may contribute to loss or alienation, and I think here for a lot of people have lost or feel more isolated during COVID, and the things that are familiar to them and valued, for example, spending time with family may be something that has changed quite a bit for many. And social roles and networks. So I think, COVID is interesting. For many people, they may have lost their social roles, so they are not playing, getting together with friends to play mahjong or bridge. They may not be participating in their volunteer activities. And for a lot of people, may not be caring for younger children. That might have been something that was very valuable to them. So the one things we always want to look for is these hot words: loneliness, social isolation, and also poor coping skills that may contribute to mental health outcomes. Okay, so we know that people who really have a hard time either have not had coping skills that were very healthy, or the ones that were healthy for them have been removed, and those who are more socially isolated. Also, individuals who kind of resist finding new ways of finding meaning have a hard time. Those who cling to former routines, I can't tell you how often I hear, well, I want to do it the way I've always done it, and any other way is not acceptable. Also limited choices, which I think a lot of people have faced during COVID, because choices have been limited for many people: how to socialize, how to be active, and refusing opportunity for growth. And I see, and this one I'll say is that I work with a lot of people who have been quite resistant to using technology as a way to remain socially connected. And I think that for a lot of people has caused a lot of stress, because as we see, this is the new form of how we connect with other people and educate ourselves and remain in contact with our community. So loneliness is a very hot term right now. If you do an internet search, I think the New York Times has probably had, and other newspapers have had, about an article every week at minimum about loneliness, not in relation to COVID, and even preceding COVID, loneliness is something that's been really widely talked about. Cigna, the health insurance, actually released a research study in January of 2020. So that surveyed the population that they serve. They had 10,000 Americans ages 18 and over that completed the survey. And an alarming number of adults reported loneliness or feeling lonely. 61%, so about 3 out of 5. Major factors were the lack of social support and finding too few meaningful social interactions. So we are social. Human beings like to be with other human beings. So it's definitely something that we have to identify. And this is pre-COVID, of course. And they also found in the adults who worked that individuals who telecommuted were more lonely than those who worked in the office, which is so interesting because now everybody's telecommuting, right? And loneliness they found certain demographics where loneliness was identified. So men slightly lonelier than women. Younger people are lonelier than older adults. I think, maybe I'm biased because I work with older people, and I do think they are much more resilient than the generations after them. I think older people have a different sense of community and socialization that younger people do not. I think probably the phenomenon here with younger people 18 to 22 is that they're more reliant on technology for socialization than generations before them. And in reality, if you look at research on technology and Facebook and Twitter, even though people have hundreds and hundreds of friends, they are very lonely and don't feel connected. And then, of course, people living in urban areas and suburban communities reported feeling less lonely than rural, which makes some sense because there's probably more opportunity to connect and be part of the thing. So loneliness was already something that we were all thinking about and talking about. And we know that individuals who are lonely are more at risk for mental health and medical conditions. Because we do know when people are not feeling well emotionally, they don't really participate in their well-being when it comes to the health side as well. So, I think this is why medicine in general is very interested in targeting understanding depression and anxiety and loneliness and sadness, because it impacts how we take care of our well-being when it comes to compliance with our medical interventions. So social support. We know this is extremely important when it comes to well-being, and really one of the factors that helps target loneliness. So we know that the way our social relations have a significant influence on our overall well-being. Supportive relationships are those that we hear really give us the most important outcomes. And actually, when we have inadequate social support, it is a risk factor. So when we talk about social support, it isn't necessary, we measure it in many different ways. One might be just how many people do you have available to you? And another question is, the quality of the relationships. And we actually know that quality when it comes to the relationship with mental health, it has much more of an impact than the number of people that people have access to. So we know that social support increases positive affect, and also it is correlated with stability, predictability, and overall people feeling connected and part of a community. So as I said, there's quantitative and quality. Again, it's the frequency of contacts as well as how we perceive our contacts. Both are found to satisfaction, but again, the qualitative subjective relationship has the stronger predictor. So if I say I have a really great relationship with 2 friends and I feel really supported by them, that for many people may have more of a correlation with positive impact than I have 20 friends who I don't speak to very often or I don't feel I can count on. So in some research, we call this as a stress buffering model, that actually having these beneficial social supports buffer or protect us from any negative stressors. We find this, and again, about really the quality of the relationship, and it protects the individual from stress. We also know that social support, there's some literature that shows that it can actually help in recovery for people who have minor depression. And the crux behind social support is that people feel a sense of acceptance, increases self-esteem, and again, as we said, stability and predictability. So how can we can find social support in our community, even with retirement? So we want people we know that counseling or mental health services can be one way to help people. Counseling can help people focus on what their needs are, actually help people find new ways to find this. And again, this is in retirement, but this can also be in any other phase in one's life. Some people, when we talked about transitioning, and I know a lot of people are not doing that right now, or especially moving to some of these assisted living or independent livings, but we do know for many individuals as they age, that some form of structured living environment, and I think, the Norks are on here. It's kind of the naturally occurring retirement community, which I think is fascinating. There really is that nice sense of feeling like you're part of something. So, someone who lives in a community where there are individuals of like age or like interest really do feel connected in a different way. I mean, that's how we tell people to make friends, find someone who likes the same stuff that you do, and then you have something to talk about. And then there's that connection. So, okay. So I see some people have sent some comments. So again, someone wanted to ask a little bit more on loneliness, which I will go back to. So older adults in the community, possible access to a number of activities, right? So volunteer programs. This is one way to target loneliness, really kind of feeling in a community. So people may ask me, well, how do I volunteer now in the time of COVID? The wonderful thing is there's a lot of virtual volunteer opportunities. There's also, especially here in New York, there's a number of different programs where they're looking for people to communicate or reach out to people via telephone, which I think is really great. So though it may seem that some of the typical volunteer programs are not active, they have all become quite creative of how to do things virtually. So that is still something I think is really tremendously helpful. I think on multiple levels, people find meaning in volunteering. It's a great way to meet people. And really, if you're in a phase of your life where you have the opportunity to participate in volunteering, I think it's really quite valuable. You can do it within your own community, people who do it within their religious communities, and people can do it more broadly as well. If you're a person who's aging, senior centers are really great. I know they're all closed right now. I think my understanding is they've all done a really great job of doing things virtually as well. Local libraries, everything, programming like this, really kind of getting connected. Education. Here in Westchester, and New York City, we're quite fortunate. There's a lot of programs that provide low costs college courses for older adults. And when I say older adults, they do 55 and older, which I don't really think constitutes older adults, but if you'd like to do it, it's a great opportunity to do it. So that's a great opportunity. And then caring for children, which I know may have changed for some people. So there is a tremendous amount of research that finds the benefit for the grandparent and the grandchild if you are a caregiver. So that's one thing to target. And I know that for a lot of people, this is a stressor because this has changed, because people are not seeing their family as much during COVID. But again, for all ages, you can do the volunteer programs, I think, are wonderful, and the college courses. So even if you're not someone who can take advantage of the 55 and older program, you can audit college classes absolutely anywhere. And now, since things are all virtual, I know someone who's taking a college class in California for an art program that she wanted to do when she was in her 20s, but now she's in her 40s and her life doesn't bring her to California, but she's just doing it now because anyone has access to doing that.
Dr. Marino?
Yes.
It's Elisa. Gina had a question for you. Yes. Gina, you want to go ahead, unmute yourself and ask the question?
No, that's okay. You can ask her.
Oh, okay, sure, Gina.
I'll read it off. I mean, I didn't have a question. I just had a comment. It's very interesting statistics. So what do we do now about this loneliness?
Well, yeah. So I think
volunteer programs have ended that I participated in.
So I think part of it is that flexibility of finding things outside of what we had typically done. So I think, if you're someone who really benefits from volunteerism, it's finding other ways that we have volunteering that's more virtual. So you're not going into an office or a place where you can volunteer one-on-one. but I know there are a lot of different programming where they do have virtual volunteering or calling people and checking in on them. And I do know that, I mean, I don't know how people feel from a health perspective. There are some places where there is in-person volunteering. You know, I know food banks are desperately looking for people to come and volunteer and help package food and distribute food.
Right.
Local schools are looking for that. The college courses, I think, you know, during this time we have to think, since so many things are closed, we have to think outside the box. And my whole thing with everyone is, the real crux is what you feel comfortable doing, right? I mean, I think one of the challenges with COVID, there's no clear direction of what you can and cannot do. I think everyone's just kind of figuring out what is recommended by, you know, what's being recommended, and what we are comfortable with. You know, there's some people who don't want to leave the house, period, and that's fine. I understand that. And there's some people who are open to going out to lunch with a friend, outdoor seating and things like that. So I think everyone's got to figure out that balance of what they feel comfortable doing socially, still being respectful of their values and their concerns around health.
Thank you, Gina.
Yes, thank you. Thank you. I think Jenna just posted a very nice Volunteer New York resource for people to take a look at. So, and I think it really is finding that fit between you and the activity. So I know that, you know, I am seeing more and more, you know, groups that are meeting in parks and people that are going out and doing things like now that, you know, the gyms have gotten the okay to open up. I think a lot of them are actually doing things in public places where they can remain 6 feet apart and still do things. So it's different. And I think it's being kind of creative about what you're willing to do. And it's finding that fit, right? And I think, you know, COVID has been particularly more difficult in people who live alone, in one perspective. And then I also hear the stress of people who live with others, especially if the relationships do have some level of conflict. But I think that there is no right kind of fit. Like, you know, having a partner and or children at home isn't necessarily mean someone is not lonely. I think it's finding what fits for you. And I can tell you, I work with some people who don't want to do anything outside socially. And then I have some people I work with who, you know, have rejoined their Mahjong game in a healthy way, and what they feel comfortable with. So I think everybody's got to figure that out for themselves. And loneliness is something we've been trying to figure out for decades. I think it just become much more pressing during this time because so more and more people are now we're isolated. So again, we want to look at the satisfaction with the support, personal networks. I think, you know, Zoom, FaceTime, Skype, whatever your venue is fantastic. You know, try to use that in a way to have social interaction with peers and with family. Someone gave me a really great idea. They said they have family who lives across the country and they never thought about it before, but now they have dinner together once a week, you know, via Zoom, where they would never have thought about that 6 months ago, you know, kind of thing. So I think we got to think creatively during this time. Okay. The other thing you might hear is the psychological flexibility people talk about. It's really modifying our expectations. So if the expectation for many is that they want to continue the social activity in the same manner as they had before, that's where I think people struggle the most, because we have to have that new way of looking at things. You know, our new role socially, our new role with other people. I know for many, unfortunately, people have lost their employment and might be struggling with that stressor as well. But also, you know, how do you find I think loss of employment is multiple pieces. One, obviously the financial stressor, but people losing their role of what their career was and what, you know, having to, even if it was getting online every day from 9 to 5, having that role and that expectation. And it's finding kind of a new meaning. So where is the importance of mental health needs. So, typically, because this for everyone, in general, 1 in 5 individuals, regardless of age, 20% of our population struggle from depression at some point in their life. We do know that during COVID, because of loneliness and social isolation, as well as other stressors, the number of people struggling with mood disorders has gone up. We don't know specifically what that number is right now. We do have some research out of some other countries who are ahead of the curve from us, but I will reassure you that older people do not experience depression more often than younger people. But we know that depression is really important. It's important for multiple things. For all age groups, it's underdiagnosed and undertreated. And I think what is alarming, I think, for me, and I think mental health in general, is that as people are more isolated, we know that not only is that a risk factor because their mood is impacted, but a lot of times family and friends don't notice that someone is suffering from depression because they're not seeing them as much, right? So I always used to kind of say, hey, we always see a surge of mental health referrals following the holidays because someone finally went to go see their mom that they haven't seen in a while, or their cousin or their sister, and someone said, oh, it seems like you're not doing as well, why don't you see somebody? And now, even more with COVID, a lot of people haven't seen their loved ones in months. So that, I think, is also a challenge. The other is that people are not going to their physicians or their doctor's appointments as regular. I will encourage everyone, I know the message is go for your appointments because it's important to take care of your health. So people are often overlooked and they're not diagnosed. And in general, most of us are not really great at kind of seeing when we're not feeling well, or we kind of normalize it and kind of blow it off and say, oh, that's just because everybody's feeling depressed right now. But that might not be true. So this is just a demographic of what are the risk factors that I've been talking about. As you can see, this is aging. Really at age 40, we see a number of risk factors that people don't have earlier on in life, higher rates of anxiety disorders, and as soon as you throw the medical comorbidity in, the risk factor for depression goes up. So I think that's really, and stressful life events. And I think COVID is a stressful life event regardless of age. So here again, long-standing vulnerabilities. This is, some people are more vulnerable to mood disorders compared to others. The big thing is, genetically, if you have a family history of mood disorder, there's a vulnerability there. If you've struggled with mood issues in the past, that's also a vulnerability. And then you throw the stressful life event, and for those that have medical comorbidity or disability, there's an additional factor. So I like to educate people to understand that depression typically does not go away all by itself. I feel depressed 1 or 2 days, yeah, that can go away by itself. But if you have a genuine depression that lasts 2 or more weeks, the best way to get through it is with intervention. Getting help is not a sign of weakness, though some people may think so. I think we've done a really good job at trying to kind of challenge the stigma of mental health, but I think it still is very much something that's out there. I know that certain people believe if they work hard enough or they weren't, there's something wrong with them and that's why they're depressed, they're not trying hard enough. Getting help is not shameful. No one's ever too old to get help. And there is a myth that some people feel like they won't be in control if they get treatment. I hear this most specifically with medication options. And then some people really don't like to tell their doctors because they don't want to disappoint them. So primary care facilities are wonderful. I think that if that is your foot in the door, you should definitely let your doctor know that you're feeling depressed. Just be mindful that when your doctor sees you, I know they are rushed for time and people usually have a list of things they want to tell their doctor. So mental health providers, I think, are always the most efficient foot in the door if people want mental health treatment. One of the criticisms and things I often hear is mental health insurance limited is limited, which I agree, very much so. And I think that's a systemic issue, but the thing is that there are providers out there and you can explore that. And that the good news is that depression is actually treatable. We frame it as a medical condition. Up to 80% of people are treated successfully, and you can feel better within a few weeks. I will typically tell people you have to give treatment at least 2 months to actually start seeing the benefits. And I think that, unlike some other medical conditions, is different and sometimes frustrating when you're in treatment. So many people may know that antidepressants are a form of treatment, therapy or counseling, and then some people with mild forms of depression support in self-help groups. The good thing about the self-help groups and the support groups, they're all virtual now, and they run very nicely. And they for many are free of charge. The one thing I will say, they are not facilitated usually by a clinician. They're facilitated by peers.
So thank you again, everyone. We really appreciate this. Dr. Marino, I really loved your presentation, learned a lot today, and we're all in this period of transition, whether we're dealing with COVID, but we're also having parents who are no longer able to drive, or we're caring for them, or ourselves are facing retirement. This is information we can all use. So thanks again for your time today.
This is my pleasure. Thank you everyone for joining.
Thank you.
Bye.
Thank you, everyone. Bye-bye.
Thank you. Stay well, everybody, and be safe.
Yep. Thank you.
Take care.